Healthcare affects all Americans. We know that. It is a situation whether if you don't have health insurance or access to good quality health care, some people think, well, is there a crisis in America today? And I would submit that if you're a parent and your child doesn't have access to quality health care because it's too expensive, it's a crisis to you. If you're an employer and healthcare costs are running out of control and you can't afford to give your employees raises, or if you frankly just can't afford to stay in business any longer because healthcare costs have gone up too high, then it's a crisis. So I think we have some serious problems in the healthcare industry in the United States. And what this hearing is going to focus on is one of the best ways that we can control cost and, in fact, make health care available to a lot more people if you bring the cost down, and doing that through encouraging healthy behaviors. The bottom line is that not only will making healthier choices save money in health care, but people across America will be healthier. They will live better quality lives, and that's a big reason that we're having this hearing and trying to focus so much on encouraging people to make healthier choices in their lives today. A lot of people are saying we need to spend more money, more of our national GDP on health care today. And I would submit that if we do the things right, we actually spend, almost 17% of our gross domestic product right now spent on health care. That's at least 3 or 4% more than any other country in the world. And I would submit that we spend plenty of money on health care. We're just not putting the incentives in the right places, and I think that's a big purpose of the hearing today, is to show that if you do things right, you can actually lower the cost of health care and use some of those savings to make sure that all Americans have access to affordable health care insurance through the private sector.
We really do not have a health care crisis in America. That's the often used word. What we have is a health crisis. The fact is about 80% of our health care expenditures are spent in this country on chronic disease that could be prevented or cured if we had different lifestyles. And the 3 lifestyles primarily driving chronic disease are overeating, underexercising, and smoking. What we truly need is a transformational approach that approaches the health issue as one to change from our current system, which is not a health care system, it's a disease care system. We need to begin looking at prevention as opposed to intervention. One of the concerns that I think has to be addressed is that if we're going to truly see a health care reform, we need to look at it as being approached from systemic changes as opposed to programmatic changes. And by that definition, the entire system is upside down because it is based from the way we train doctors to the way that we reimburse the physicians and the providers. It's all based on the idea of waiting until there is a disease, waiting until there is a crisis, and then trying to figure out how to pay for the intervention. One of the things I would point out is that America's health is a whole lot. It's been described like an NFL football game on a Sunday afternoon. 22 people down on the field who are in desperate need of rest, and 70,000 people up in the stands who are in desperate need of exercise. And that's a pretty good picture of what's wrong with the country today. My personal experience was one of having to find some transforming behavior, but it resulted in policy changes in my state. We became the first state in the country to recognize that if we can get people off tobacco, whatever costs there may be involved in that are much less than the cost associated with tobacco-related illnesses. Not being facetious, but the truth is we started looking at things, for example, giving employees cash benefits for their healthier choices. Simple things, $500 per employee, $1,000 if they included their spouse for doing a health risk assessment. We were amazed at how many people would simply do the health risk assessment because it was money in their pockets. When we provided the smoking cessation tools, a lot more people were willing to participate. I do want to say thanks for taking on this issue, and I would hope with all my heart that there would be a sincere effort as we look at the changes needed in the healthcare system of America, not to so much look at just how to access more people into a flawed system, but to change the system itself. Because if all we do is get more people into a sinking ship, we really aren't doing the country and the future of our children a great favor.
I would only say that the health care debate is something Republican senators are committed to. We want to make a change. We want to do it this year. We want to do it in a way that makes sense. We want people to be able to afford their insurance, have choices, not have to wait in line. And your example, as well as your leadership as governor and nationally, has been a real effective way to put the spotlight on prevention and wellness. That is one area about this health care debate that we may find consensus on between Democrats and Republicans. So our challenge in the next few weeks is to understand specifically what provisions should be in the law that would make it easier for employers and individuals to give incentives for wellness and prevention.
As a primary care doctor, I have seen the numbers of Americans with preventable chronic disease. 133 million Americans, that's one of every 2 American adults has at least one preventable chronic disease. And these preventable chronic diseases dominate our health care costs, $2.2 trillion each year, 3/4 of the costs go to treating chronic disease. We need to hit the reset button and stop rewarding sick care, start rewarding prevention and healthy behaviors. Toward that end, in your legislation, I urge you to include funding for preventive medicine residency programs and primary care. More focus needs to be placed on prevention in our medical school curriculums. Having gone through that and seeing how little there is in our medical school curriculums today, and also preventive medicine training programs need to be funded and recognized throughout our country. Taking care of my body has served me well, not only physically, but also mentally and spiritually. For me, playing competitive sports and being disciplined about nutrition, physical activity has fostered confidence, perseverance, and team spirit that has led me to this room today and has given me the opportunity to work on improving the health and well-being of millions of children who are our future.
Set of numbers, everyone needs to understand that we're a pretty large organization with some 200,000 employees. Of those 200,000 employees, we have about 30,000 employees that would be non-union employees, and the balance would be union. The reason I make that separation is that what I'm going to talk about in terms of the progress that we've made on health care, it affects both populations. We've made more progress on the non-union side only because we don't have to wait for the next bargaining event to make that happen. Started in 2005. In 2005, we had health care costs of roughly $1 billion, and they were increasing at a rate of 10% a year. So in 3 years' time, I would see a $300 million increase. And this to us was initially just a cost problem. We made a great discovery, which I think was little known at the time, may still be little known today. And that is that 70% of all health care costs are driven by people's personal behaviors. As a business guy, that was a large dose of good news, because it said if I could influence behaviors of 200,000 people, I could have a dramatic effect on their health and therefore our costs. The second major discovery, which the governor talked about earlier, the numbers are between 74 and 80%, but well recognized in that range, you have 4 chronic diseases which are consuming all these costs. Those changes have allowed us to keep our health care costs on a per capita basis absolutely flat. At a time when the rest of business and American industry is up 38%. We've done it by encouraging our employees to be healthier. Last year, we introduced a program that's called Healthy Measures. And under the current law, it's important that that be a voluntary program. 74% of our employees signed up for Healthy Measures. And right now, the 4 measures that we're focused on would be smoking. Second would be obesity. Third would be controlled cholesterol and controlled hypertension. So what we've done is we've structured incentives so that if you don't smoke, you have a lower premium in our company. If you are not obese, you have a lower premium. If you're, it's okay to have hypertension, but it must be controlled. In fact, 17% of the people that were measured discovered for the very first time that they had hypertension. And then cholesterol level, also people discovered that they had high cholesterol, so they could begin to do something about it. We provide, if you have family coverage, the total incentive granted to our employees is just under $1,600. I'm a firm believer that if you make changes on incentives, if you make changes on cost and quality transparency, provide electronic medical records, get some of the inefficiencies out of the system, that consistent with what Senator Ensign said in his opening remarks, you can finance health care for the 47 million uninsured out of the efficiencies in the system. And I consider behavior to be the fuel that really drives the engine of change here. The other thing that's unique about our program, if you have a BMI index of 36, which is considered obese, and you make 10% progress in the next 12 months, we write you a check to reimburse you for the premium difference you had at the start of the year. We do the same thing for smoking, cholesterol levels, and hypertension.
I'm sure all of you have alluded to this, and Steve, you alluded to it even in more specificity, and that's that prevention, wellness, and disease management are absolutely crucial. Burd, you were very creative at Safeway, as was Dell, as was SAS, where if employees didn't enroll, you went the route of writing them a check or giving them a financial incentive to do it because the dollars and cents you could prove.
There's so many factors that go into it, and what I struggle with when I go out and speak with these children is what is going to motivate them to be active, to be healthy, to eat right. And continuing on the last question and a conversation we had about incentives, on Monday I was at a school in Washington right here, and I said, what's it going to take to get you to work out 60 minutes a day? And this little child said, pay me. That's the reality of the situation right now. And the way that you affect behavioral change is, one, you could start with having somebody that is right there by your side. It's motivating you to get over that hump to physical activity. Two, you see a role model, a public figure, such as Governor Huckabee, such as a professional athlete, someone that you look up to. Hopefully, you'd like it to be your parents that you want to be like, and they enable you and empower you to have behavioral change. And this just isn't with children, but this is across the country in all populations. But what's really going to get people at the end of the day to start changing their behavior is, hey, if you have a choice to go and get a bottle of water or a bottle of soda, and if you get a bottle of water and we're going to give you 50 cents back in your pocket, or if you meet these benchmarks at your workplace, we're going to give you a rebate. That's what it is.
And maybe Lamar already mentioned this, but we've had this discussion amongst ourselves that you know, this generation of Americans will be the first generation of Americans that doesn't outlive their parents. I know that in my state of South Dakota, we have acute problems, particularly on our reservations, with diabetes and obesity, and it seems to me at least that many of those issues are impacted, as has already been mentioned, by behavioral change, lifestyle changes.
Mr. Burd, I know that at Safeway, you have, obviously you're a big company with an ability to collect a lot of important information about cost and outcomes of healthcare procedures. And I recall you talking about just the variations in costs of common procedures like colonoscopies. I'm just wondering if you would tell us, I know you've said this before, but I'd like for you to repeat it. What can we do to empower patients and consumers with information about costs and outcomes that will make them smarter consumers so they can make decisions about their health care instead of the government?
I think the main role of government here would be to remove the obstacles so that a free market is capable of working.
I want to thank all of you for what you're doing out there and to encourage you to continue. This is really, I think, the key to healthcare, actually making it a system that will work for all Americans at less cost and obviously have people live in better quality lives. So I appreciate all of all three of you, you were a perfect panel for us today to be able to have from three different perspectives, and I appreciate what you're doing on a personal level. You're all showing. I know, Steve, you didn't mention your own family's heart history, and quite significant. We do have to get some of these advocacy groups to change their mental thought processes as well. I mean, I've heard that the American Cancer Society, for instance, is against us providing incentives for decreasing tobacco use other than tobacco taxes. They don't want to see a change as far as premiums are concerned, which doesn't seem to make any sense. It would seem anything that we can do to decrease tobacco use in this country would be a very good thing for all Americans. And so I think that that's something that we need to continue to work with all of the various advocacy groups, and even with obesity. I know there are some people who genetically there's not a tremendous amount they can do, but the vast majority of the people who are obese, it is strictly behavioral. It is it's not something that they can it is something that they can overcome. I mean, Governor Huckabee, you're a great example of somebody who turned his life around, who's, I mean, and you don't have to become a marathon runner like you did to do it. You can do it with real common sense things. And I think if we provide the proper financial rewards for folks and use a carrot and a stick type of an approach, whether it's Medicare, federal, private insurance, Medicaid, all of the various programs that we have out there, I think that we can turn this thing around and truly end up with a healthier society. So I thank all of you for being here today. You're an excellent, excellent panel, and thank all the senators as well.